Hello, and welcome to Health is the Key, the podcast that explores the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore. Today, we're talking about a mental health crisis among teens in the U.S. In a 2023 survey, more than 5 million adolescents between the ages of 12 and 17 had a diagnosed mental or behavioral health condition. That's about 1 in 5 teens. Whether you're a parent, a grandparent, an aunt or uncle, a cousin, or a friend, you may know a young person who's struggling. So today we're pleased to welcome Dr. Michael Kisicki, an associate professor at the Icahn School of Medicine at Mount Sinai in Pediatrics and Psychiatry and Chief Psychiatrist of the Mount Sinai Adolescent Health Center. Dr. Kisicki will explore this crisis with us, share signs to watch for, and offer ways we can all support the mental health of the teens in our lives. Welcome to Health is the Key, Dr. Kisicki.
Thank you. It's great to be here. I really look forward to discussing this with you.
Thank you. So we hear so much about the crisis now in the news, and we were even hearing from the kids themselves. A NAMI report, the National Alliance on Mental Illness report, recently found that 64% of children surveyed feel the world is more stressful now, and about 1 in 6 report experiencing negative emotions all the time or often. Is that what you're seeing in your practice, and can you explain a little bit about what's going on?
I've been doing this for 20 years now, and the level of desperation that parents and kids themselves are calling, trying to get appointments to meet with myself or my colleagues, is unlike any other time in which I practiced. And we'll talk about a lot of theories on why maybe that is, but it's palpable. And the emergency rooms are seeing it too. The numbers of people coming in for suicidal ideation, suicidal behavior, not going to school is increasing tremendously to the point where kids are waiting in emergency rooms for weeks trying to await a bed in an inpatient facility. All the numbers you're saying are exactly what I've been hearing. So this is a real health crisis. Also, our ability to meet the need is insufficient. An analysis of health services showed that 20% of the need is just not being met.
That's what I wanted to ask you. And a lot of people are talking about, is this a result of there are more cases, or is it more awareness, so it's better diagnosis, or is it a combination of the two?
Yeah, I think it's both. And I can speak mostly to my own experience. I've had the kids who are coming in because of things they've heard on TikTok, and they're sort of what people might call the worried well, that they've got this idea of maybe they should get some worry or concern that they have checked out. And that's welcome to me. I'd rather that than them be at home suffering on their own. But I also think there's something very real. And, people pointed towards the pandemic. They've pointed towards social media. They've talked about the political climate. They've talked about there being less financial or occupational opportunities. Those are all probably true.
Right. There's no one cause.
That's right. That's right.
And what kind of conditions are you seeing in your practice?
So I specialize in post-traumatic stress disorder, but I also see a fair amount of depression and anxiety. And those are the big things that are increasing, in terms of all the statistics that we're talking about this afternoon, point to depression and anxiety increasing. I think the numbers with other severe mental illness like bipolar disorder, schizophrenia have largely stayed the same, but also substance use, so that is also increasing.
And it strikes an audience that's particularly vulnerable, teens. There's a lot going on in high school and friendships, family relationships. So how can a parent tell the difference between when it's typical teen behavior or when it's a little bit something more?
I think when a parent is thinking about this, the first assumption should be to normalize, because the more a parent appears concerned, freaking out, the kid starts to worry, because they understand themselves as a reflection from their parents. So say I'm feeling sad and my dad sees this and he seems concerned. Well, then maybe I should be concerned about my sadness too. And so I think the first place should be just trying to understand your child, not trying to come to the rescue, not trying to get other people involved, but just to better understand. But to your question, there are some ways to measure this, to measure what's just the ups and downs of life and what's an actual issue that needs attention. When there's dysfunction, when a kid's grades are dropping, not going to school as consistently, more tummy aches, headaches, not going out with their friends, not wanting to play the sport that they wanted to play, or if it's just a change in attitude or change in personality. If your one-time bright, cheery kid becomes uncharacteristically irritable or aloof, that's something to take note of. Okay. Now, absolutely, a young person needs attention if there's safety issues. Okay. If they're not eating enough, they're losing weight, or if they're cutting themselves, or if there's a threat of suicide. Absolutely, you need attention. Now, in situations less severe than that, though, it's sort of something that needs to be a conversation with the child. I mean, if a kid's really motivated to get treatment, I might have a lower threshold to get them that attention because, if they're motivated for treatment, I think even small issues could be addressed professionally. Also, you just need to listen to your gut. If your gut's telling you something's not right, I think that's coming from somewhere because you know your kid better than anybody else.
Right.
But the flip side of that is I've seen a lot of denial. And I understand it. You love your kid. You don't want anything wrong to be going on. And so you make up a reason. Well, they're doing this because of this, or it's because of that. And so if you're sharing the parenting, it's good to have these discussions with your partner. Or listen to when the teachers are saying, Johnny's looking a little different. And also sometimes leaning on other family members too. If it's, if your child's really close with the uncle or the aunt, those are people to also discuss it with.
Getting a check-in with them.
Yeah. Yeah.
I like what you said about the child feeling sadness and then getting concerned because the parents can seem concerned. And, in all that we've read that reacting to a sad situation, sadly, is normal. Right?
That's right.
And I think what you were saying about normalizing something, parents may want to cheer them out of it. Like,
Yes.
It's okay. It's not so bad. And then the child doesn't feel heard and just feels they're minimizing my emotions.
That's right. That's right. So that's why it's important to learn that, emotions happen, feelings happen, and I am going to manage it. I am going to get through it. But in those situations, when you don't, then you get the help. But that help is just to help deliver that power to you.
And if a parent reacts that way, the kid internalizes, oh, well, maybe I can handle this. And maybe mom and dad do have to handle this for me. So are some children more susceptible to this than others?
Yeah. So in almost all psychiatric conditions, there's a genetic component and an environmental component. And we know certain populations are a little bit more susceptible to depression and anxiety, and those who also experience a lot of early deprivation during their development, those who've had a lot of medical illness, those who have speech or language deficits, people who lack consistent parenting. There are definitely a lot of more susceptible populations.
How can a parent know when they need to just listen to the child and validate the child, or they need professional help? And what do you do then?
So always start by listening and modeling also for your kid that it's okay to talk about feelings. And if you feel that these problems are becoming more frequent. They're getting in the way of them being able to get to school, to be with friends, sort of taking them off their developmental track. I think it's a good time to get some professional consultation.
And that brings us to the question, where do you begin? As you were mentioning that, I think you said a third of children aren't receiving the care that they need.
There's a 20% unmet
20%.
need, yeah. Which, to be honest, I think that is an underestimation. The depth of the waiting lists I see at outpatient clinics tells me a different story.
And I think that parents are, trying to find the quote right therapist and the right therapy and someone who's in my insurance, and it is quite a challenge to find the help that your child needs.
It is. And so I have a few thoughts on that. One thing is sometimes the best help can be non-professional. Getting kids involved in community programming can really do a whole lot, because I think there's a lot of disconnection. Kids are not feeling the sense of community maybe that they've felt in the past, or they feel more alone for various reasons. And getting them involved in some kind of activity like a team, Boy Scouts, church activity, something that makes them feel like they're part of something, that makes them feel like they're contributing, that can do a whole lot, And sometimes I've even seen therapy get in the way of doing these awesome, great things that can actually improve self-esteem and developing relationships. And that, to me, is sometimes a mistake. Now, with that said, there is always a place for treatment. So I'll talk about that. So there's various different forms of interventions. Individual therapy is the most common form.
Talk therapy?
Yeah. And finding the right fit is very important. You hear a lot about the different types of therapy, but the most important thing is the connection. And a lot of research has supported that, is that the rapport between therapist and patient is the most predictive factor on outcomes. Sometimes the best way is hearing if they have a friend who's connected with a therapist. That's going to help them engage, because there's already a little bit of a trust there. Or if a parent has a friend whose kid is getting treatment, that's a good way to find a therapist. Sometimes I even recommend to families doing a little bit of interviewing. Maybe plan on meeting with a couple. Now, if you give completely free rein to a child to choose, they may say they don't like any of them.
Exactly.
So it's a little bit of a give and take, and maybe sort of say, well, they can choose of them, but they might be able to get what they can get. And I would say most therapists are open to suggestions from families. If some approach does not work,
try something.
Let's talk about it, right? So that's one form, but there's group therapies that work well. At my clinic, we have a dialectical behavioral therapy treatment program that consists of individual therapy, group therapy, parent coaching. There's also phone coaching if things come up between sessions. And for more acute or impairing conditions, there's partial hospital programs where a child can go in every day to a treatment. They don't sleep over like they're in the hospital, but they'll receive a little bit more attention. They'll see a therapist more often, a psychiatrist more often. There'd probably be some group activities. And there's also a growing number of virtual options that surprisingly can work really well. And some kids really connect in that way. I have some patients who are on the autism spectrum, or who have significant social anxiety. That's sometimes the easiest way for them to start treatment.
And you had mentioned earlier stigma. I feel that kids today are more accepting of differences and neurodivergence and things like that. What do you do if a kid just refuses to get therapy? They know they need it, they need it, and they just say, nope, I'm not going to do it.
And we see this the most with boys, young men. It's a population we just really have a hard time getting into treatment. The bottom line is therapy often does not work if
Mm.
the person is not interested.
Right. They have to buy in.
Exactly.
Mhm.
Now, I can think of a few exceptions to that where the kid has come kicking and screaming and it has ended up being helpful, but most of the time there has to be some buy-in.
Mm-hmm.
Now, even if your kid is not interested, a skillful clinician can learn to work with a kid, finding a way to meet some common ground, find some shared goals, something that they're interested in. So to try, at least, ask your child if, will you please just go once to meet, Dr. Mickey? And as much fear as people have about kids not being interested in going, more often than not, I feel like end up liking it, Someone who will listen to you, have positive regard towards you. That's a nice thing. And for the most part, I think kids can get into it.
What role do schools play in helping children?
Yeah, so this is a new thing.
Mhm.
As I mentioned, I've been doing this for a couple decades, and just kind of more recently, we're seeing schools getting much more involved and a lot more savvy about this. And Mount Sinai, where I work, we have clinicians in several schools, actually, social workers who kids can meet with to discuss their mental health concerns. And I've seen schools do all sorts of things to meet the needs. And one of the biggest issues recently over the past few years, definitely since COVID, has been school refusal. Huge problem. It's a really hard problem. And schools are just now, I think, starting to develop ways of addressing this, even, going into the homes in some situations, and increasing what's offered in some of the special education. So I love to see services in school because it's a little less stigmatizing, and kids don't mind getting out of class to go to therapy, right?
Sure.
So I love the idea of putting services in school, and I hope we see more of that.
Mm-hmm. When you talk about family getting involved, it's important to note that it's not just the child. If a child is struggling with mental health issues, he or she is not the problem. It's part of a bigger dynamic. Can you explain a little bit more about that?
Yeah. This is actually what I usually see with kids, is that it's just a symptom of a larger issue. It's not always a problem with the family, but there's always some kind of family component.
And family input will help in the healing process.
Absolutely. And, I think the imagery of the canary in the coal mine, of a kid being the person who's what we say is the identified patient, whereas the family is struggling. The kid is the one who's going to be having the stomach aches, who's going to be missing school, who's going to be irritable, who's going to be losing sleep. And also, I think for some families, it feels easier to bring the child in for care than sort of getting care for themselves. And that's why the best treatment involves the family. And that can look like family therapy sessions or parent coaching sessions, or encouraging the parents to also get help for themselves.
And it lessens the burden on the child to think, oh, I'm the cause of all the unhappiness in my family. It's all because of me.
Yeah. Yeah, because that's where kids are developmentally. They think everything revolves around them. So, of course, mom and dad's problems are because of me.
Right.
And when I work with adults, I'm often untangling that damage that's been caused, where, my parents' divorce, I still blame myself. And those thoughts and beliefs we have that we first develop in early childhood, they stick with us. Even if they make no sense, they stay there in our heart and cause disturbances.
Well, now that we've segued to the parents, I would love to talk about supports for the parents as their child is getting treatment, and what they can do for self-care, or even just their contribution to the therapy that the child's receiving.
Yeah. So one thing that I say often to parents, and this is more of just a reframing of attitude and responsibility, is that the goal in a lot of ways is to be a good enough parent. The thing to remember as a parent is your influence, although large, is a lot smaller than you think. I mean, there are so many influences in a kid's life and in a kid's development. The goal should be, I need to be good enough. So support for parents. I had a parent just today tell me that one of the most helpful things was getting involved in the PTA. Interesting enough, where they were able to connect with other parents who are involved in the school and had issues with their own children. And that was one way to connect, but also getting to know the parents of your kids' friends. That's a good way to kind of get a sense more of what's normal. Because if you think back to like generations ago, there was more networks, more generations were involved in the home. So you could always ask grandma, like, hey, is this kind of normal? So I think you get more of a realistic idea of what is kind of normal and not normal by comparing notes with parents and other and hearing about other kids. So that's one support. I also encourage parents to get their own help too, because there's a lot of reasons why you would think a parent's going to have struggles too. I mean, it's stress, having a child who's got a mental health condition, right? There's genetics. So maybe there's shared genetics and a shared predisposition to a mood or anxiety disorder. There's a certain alienation too. If you have a child with behavior or emotional needs where you feel like you need to kind of be more private, you don't want to share those struggles. And getting yourself into therapy, getting yourself support in a professional sense is one of the best things you could do for your kid. Because if you're having a hard time holding on, you're not going to be as present for your child.
And that's sort of the flip side of the child feeling, oh gosh, I'm the cause of all the unhappiness in this family. The parents saying, oh God, what have I done to my child?
And it role models self-care. You're showing your kid that it's important to take care of yourself and that it's okay to talk with somebody about your feelings.
That's great. And whether your child is in therapy or not, your child is having issues or not, how does a parent or a community foster mental wellness among teens?
Yeah, so I think there's several parts to this. The most important one is balance. There's a lot of competing influences in the lives of children, and there is no one answer to mental health. Okay? So a child needs several things, and they need to be stimulated intellectually. They need to be stimulated creatively. They need to have recreation. They need to feel loved and supported. Some kids need more or less of all of these things, but making sure that all of these things are being addressed in some balanced way. And there is quite a culture of perfectionism that we're living in right now. And, we can blame social media. We can blame a lot of things, but there's some pretty high standards that people are trying to live up to. And I think instead of trying to meet some end goal, a focus should be more on growth, on a pathway towards growth. So instead of getting straight A's, it's looking at how are my grades improving? How is my attitude towards my schoolwork improving? And sort of measuring it, seeing how there's progress being made. Because I think completely having no demands on a child is not good either. For self-esteem, you need to see yourself growing, and that's very important. But those demands should be on one step forward at a time, not with a focus on sort of some perfected end result. Another thing that I think is important to encourage is connection. We talked earlier about this, but there is a lot of influence in a young person's life these days to express yourself, but not necessarily to connect. And I think kids often confuse expressing themselves with connecting. So, I'm posting a lot of things, and I'm wearing a lot of interesting outfits and accessories, and I'm showing my uniqueness, but that doesn't necessarily connect. So finding ways to help your child not just express themselves, but also to engage and to be a part of a team, be a part of a group where sometimes they lead, sometimes they follow. And lastly, I think an important thing is also role modeling for our kids, accepting of the ups and downs of your emotions, and also role modeling getting help and giving help.
Well, we can't thank you enough for coming in and talking to us about this very, very serious topic. We really appreciate you.
I've enjoyed being here. Thank you. I think we've talked about some pretty interesting things.
Thanks so much. Tune in later this month to our September keynote to hear Dr. Kisicki address the influence of social media on teens' mental health. We all recognize that social media is here to stay, and teens are going to want to participate. So Dr. Kisicki discusses the challenge of helping them navigate the online world in safe and healthy ways. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.